Hi, I'm Dr. Sonia Jessup, and I'm talking to you now about what I call vaginal repair surgery. This has many different names. Sometimes you'll see it called vaginoplasty, sometimes prolapse repair, anterior vaginal repair, posterior vaginal repair. But essentially, this generally applies to women who have had babies vaginally and feel that the vagina is lax or that there are bulges after they've finished having their children. There are many ways to go about treating vaginal laxity. Some of these methods use radiofrequency vaginal tightening and do not involve surgery at all. If surgery is deemed necessary, however, the keys to getting a good result is to make an assessment of the abnormalities that are there to start with, and then repair the bulges in the vagina at the front wall and at the back wall in several layers. It is important to get the fascial tissue that may have been stretched in childbirth back to its normal position. It is equally important to treat the mucosa and make sure that the inside of the vagina lines up and is symmetrical and has the effect at the end that you cannot tell that surgery has been performed. Sometimes there is a deficiency at the back of the vagina at the introitus or at the entrance, and this can also be combined with repairing some extra skin tissue that is in this area. I perform vaginal surgery repair in theatre as I get the best results doing this procedure in theatre. Generally, patients stay overnight with a pack and a catheter in situ, as this gives the best long-term outcome. Done correctly, this procedure does not take just a few minutes. It takes a good amount of time to put the right sutures in place and to get a good cosmetic result. By understanding both the gynecological pathology and how to treat it, and using surgical or plastic surgical techniques to get a good cosmetic result, patients are generally very, very happy with the outcome. It is important to realize that for 6 weeks after surgery, you are not able to have intercourse to allow the tissues to heal. But after that, there should be no pain from the surgery, and moving on 6 months, there should be very few signs that the surgery has been repaired. So if you have issues with laxity, with bulges, with prolapse, and sometimes the prolapse can cause incontinence, these are all very treatable issues. You need to see me, get an assessment, and plan a correct length of surgery to have a really good functional and cosmetic outcome. If you have any questions or would like any further information about what I've talked about today, please feel free to call the clinic or to email us on our email address. Many women feel anxious or are not sure what they may be getting themselves into, but talking to our reception staff or nursing staff will help you think about whether it's the right decision for you. So any questions at all, please contact us and we will be as helpful as we can in providing the information that you may need in deciding which steps you want to take going forward.